So how does everybody feel for effusion, right? It's hard, right? You have chihuahuas, you have cats, you have big dogs, you have all these things coming into your clinic. Well, let's practice on ourselves first, okay? Elbows, right? If you hold your own elbow at 90 degrees, you're gonna put your index finger on your olecranon, point right here, right? If you then extend your elbow a little bit, so you're a little obtuse, your thumb and middle finger should fall into concave areas. Because on either side of your olecranon, but before your epicondyles, here is this concave area. If that, with that baseline pressure of X, right, if we just lay our fingers in there, we're not pressing too hard. If we press too hard, we may just mute ourselves or we can't feel it. We're just laying our fingers there. If that is not concave, if that's flat or convex, that joint's effused. So that's my effusion, that's my acute change. How do we feel for chronic change in a joint? We look for joint width. Okay? There's all these terms about periarticular fibrosis, medial buttress. Maybe those are things you remember from vet school, maybe they're not. Okay? But you can figure out joint width. Okay? Joint width, you take your thumb and index finger, go from epicondyle to epicondyle. Take that and compare it to the other joint. And look, they're symmetrical. So if the joints are symmetrical, they're both equally good or they're equally bad. But the wider joint is the more problematic joint. That's the chronic joint. There's something going on there. It's getting that thickening, that fibrosis. That's the opposite of muscles. When they're standing and we measure their muscles, because if we use our body equally, our muscles should be symmetrical. Okay? So if we measure muscles when we're standing, or in this case flexing, okay, they should be the same size. Don't need any fancy tools to measure this. But if one side is smaller than the other, now we have muscle atrophy. And so we know that they're not using that limb as well. We can do that in dogs. We'll show that later on. But the atrophied muscle with the wider joint, now you know where the problem is.